Yo voy saliendo de pantalla.
Agregarlos tantos afuera o
Hello, everyone. Thank you for joining this activity from the IEEE Rush chapter Guadalajara section. We are very glad to have this panel, which is called Biomechatronics and Healthcare. So today we have the opportunity to hear from the expert from different fields, from the field from biometrics and from the field from virtual reality, to share their experience, the project that they are working on. And we want to ask some questions, some really cool questions to detonate the chat between them. So we hope that you enjoy this panel. We hope that this panel can give you some insights about how we can combine biomechatronics and virtual reality to make the world better. So first, we want to thank the IEEE Guadalajara section for supporting this activity, and also we want to thank our sponsor AV Labs to help us with the platform. They offer to support us with the platform for that we are using today. We are streaming in live on YouTube and on Facebook. So here is today we're gonna have as I mentioned these four excellent speakers, panelists, Dr. Joel Hugel, Francesca Riccio, Victor Fernandez, and Marco Wansu Liu. So I hope you enjoy this panel. I didn't present myself. I am Luis Fernando Luque. I'm the chairman of the chapter, of the RAS chapter. So I'm gonna give the word to our moderator, which is gonna be my friend and colleague, Fermin Aragon. Fermin, how you doing?
I'm good, thanks. Thanks for the introduction. And hello again, and welcome to this first panel of experts of biomechatronics and healthcare, organized by IEEE Section Guadalajara. Well, the first thing we have to know is the definition of biomechatronics. By definition, biomechatronics is the combination of mechanical, electrical, electronic, programming, and control engineering disciplines. And these disciplines are oriented to living systems. However, there are a large number of thematic areas of science that develop solutions for different types of health problems, either due to old age, consequence of accidents, or disability. Today, a group of experts in different areas of technological applications will share with us a little what they work. In addition to participating in 4 triggering questions that we were taught to generate a better involvement. Each of their panelists will introduce themselves, and we will project a brief trajectory of the current work. So I will put all the panelists here. Welcome. So can you start, Dr. Joel Hegel?
Here we go. Sure, it's a great pleasure to be here with all of you and have the opportunity to talk about biomechatronics. I am the leader of the Biomechatronics Research Lab at the Tecnológico de Monterrey in Campus Guadalajara. I've been involved in biomechatronics now for numerous years. I started getting involved as I was the lead for the mechatronics program here in Campus Guadalajara, and then had opportunity to go study my PhD at Rice University under Dr. Marcia O'Malley, one of the leaders in haptics. Haptics is that area of biomechatronics that interfaces robotics and the human sense of touch, or also proprioception. We'll talk about that in a minute. But after my doctorate, I came back to Guadalajara, started my research lab. And interestingly, I've been at two other biomechatronics research labs, the one at Shanghai Jiaotong University in Shanghai, China, for 1 year in 2014. And then 2 years ago at the premier biomechatronics lab, Hugh Herr's biomechatronics lab in the MIT Media Lab. And so having that background, it's a pleasure to be here to talk about biomechatronics and the impact on healthcare.
Thank you, Dr. Hegel. Francesca, can you introduce yourself, please?
Absolutely. Thank you for having me. Everybody, it's a pleasure to be here with the other panelists and to have this conversation with everyone today. I'm a researcher at the MIT Media Lab working in the biomechatronics group under Dr. Herr. I am also a biomedical engineer, and I worked on the development of neural prosthetic devices for 4 years when I was in college, and kind of came to a realization that there is more work to be done outside of the engineering sphere in order to make an impact on the health sector and healthcare, and to get these devices to patients, which is my ultimate goal. So I kind of translated, and I did a master's in international health policy and economics at Bocconi in Milan, and then came back to work at the biomechatronics group at MIT on a collaborative project with MIT and Tech, translating prosthetic devices to patients in the US and Mexico. So happy to have these conversations today.
Thank you, Francesca. Dr. Victor?
Good morning. Oh, that's Marco. Yep. Good morning. Thank you for attending this seminar. My name is Victor. I'm a postdoctoral fellow at the University of Alberta in Edmonton. I develop a company named Virtual Gym, and the idea behind Virtual Gym is to create personalized exercise, cognitive and physically personalization for other adults. I study my engineering degree on Universidad de Guadalajara, and I study my master's degree and PhD in Simvestab Guadalajara. My purpose on the PhD thesis was to create synthetic virtual agents that represent real people in life. So how much characteristics we can have from a person that we can put it in the virtual environment, and how they behave. Thank you.
Thank you. Mr. Marco Wang-Su Liu?
Yes, hi. Thank you. Thank you very much for the invitation. Thank you for having me here. I'm very happy to share what we do and how we're trying to advance healthcare with our technology. My name is Marco Antonio Wang-Su Liu. I'm a Canadian, Chinese, Mexican, and I have a company called Happiness. I consider myself an entrepreneur, and a stubborn entrepreneur trying to make the world a better place. And in the past 5 years, we've been working with a company called Happiness, which we're working on strengthening mental health in order to help people become better better, happier in the world. We work in the enterprise space, and we're also working in the healthcare space, specifically in oncology. We're an American-Mexican company, so we have operations in San Francisco and in Guadalajara. And we're using technology like virtual reality to alleviate stress and anxiety in people in general. And I'm very happy to be here too.
Thank you. Thank you all for introducing yourself. We greatly appreciate your time in this panel. The dynamic is very simple. You will have 20 minutes for each of the questions. We will already think about what things you can share about your experience. And in each of these 4 questions we prepare, you will have 5 minutes to answer by person. So our first question for this panel is, how does biomechatronics and health direct technologies impact the training of the new professionals? And this question, it will start Joel Hegel.
Thank you very much. Challenging question. A couple of definitions. I do appreciate Fermin giving us that intro of what we consider biomechatronic systems. And I think we will limit our definition for this discussion, if everybody agrees, that biomechatronics is that interface between those mechanical, electrical, computer science, programming, technologies with systems, biological systems, and here we're going to predicate it just to human interaction, so that we have somehow all of these technologies interfacing with a human subject, whether that's a patient or an expert that we're trying to train, or simply a person. I think, I don't know if everybody would agree to limit it to that, but then the challenge here is the word professionals too. I would say, from my perspective, when I talk about training those professionals, it's training that next generation of people who have a profession, in other words, graduates from university level. And so when I think of training professionals, I go back to what I'm doing in my research lab and in my classes at the university, where I am involved in training both mechatronics students, mechanical engineering students, and also biomedical engineering students. I don't have the opportunity to interface with the medical students, but when I see that interface between biomedical engineers and mechatronics engineers, we don't have enough space and time in an undergraduate degree, a 4-year degree, to prepare either group to really have all the tools that they need to be able to develop this type of technologies and to interface with the people who are going to use those technologies. So for sure, it's a lot of collaboration between different areas, both different faculty that bring ideas to the table and their knowledge base. But what I am finding is that students are much more today having to dabble in a lot of things and know from a lot of fields and a lot of different technologies and abilities, rather than what we used to think of drilling down so deep into one particular field to be able to be a professional. Now, beyond that, yeah, I think we continue having people having to get very deep into the different fields and technologies. So that would be my start out to this.
Thank you, Hegel. Dr. Victor, can you continue with this question?
Yes, it's a very difficult question, because I think the technologies that are emerging these times is going to change the future of the training and everything around. Like if we talk just about virtual reality and how virtual reality and machine learning combine each other, you can learn from the best experts how to do a surgery, make a surgery, or how to. I was presenting a few weeks ago a paper when they captured a tennis player, and they can actually replicate all the plays that he can make based on the positions that he took. So imagine that you can play with the best of the world not only in your time, but the whole time, like in soccer, in tennis, in any other sport. And if we go back a few years ago, like 10 years ago, we were laughing about these technologies emerging, like when the Deep Blue defeat Kasparov in chess. It was even a movie about that, right? So in that movie, he complained about how they cheat on him, and how that was an unfair way to win this game. But now there is no doubt that a machine can defeat the best in the world in AlphaGo, for example, and that's a very famous algorithm right now that is emerging. So we pass from laughing about artificial intelligence to artificial intelligence became so um, strange or so smart that can actually compete with people. Now I have a partner here in the lab that address the how do you call it in English, the
Say it in Spanish and Camille
depression
translate.
the depression issue, and she find 2,200 features in a voice in 30 seconds, and she's capable to predict if the person is depressed or not based on 30 seconds of a conversation. And it's not about the words, it's not about what you said, it's not, but everything has changed now. Like computers can do better work than we can. And that's a reality right now. And we have to face this reality. So I think in training professionals and everything, it's very difficult to change the new way to see things from the old-fashioned way. Even the schools has problems in these times to adapt on the education, because when we try to teach in the old-fashioned way that we used to do before COVID, and that's not the best way to approach all these issues that came up when someone is at home and is not paying enough attention on the class, and it's not the same interaction. So we need to change that, and we need to interact. And that's in my opinion, that's one of the most important part, the perspective from the people who see the technology and how to adopt this new technology for their own benefit. Because sometimes we see that there is a rejection and a different approach that we didn't know before, and that will change either we want it or not. So it's better to accept it and learn about this process and changing, because this is going to be the future in the education and training, right?
Thank you, Dr. Victor. Marco Wangzu, can you continue, please?
Sure. Well, I think this question is very exciting. I think how technologies are going to impact the training of new professionals is going to be. I don't think we have the full scope of what's going to happen. I think the technologies that are emerging right now are helping us understand, first of all, how our brain works. We're starting to hack the brain. We're starting to understand how we can extract information from our brain, and how we can use that information in order to understand it better and to become better at what we do, depending on whatever field you're in. So, for example, using virtual reality, like we do, because we use it for training, you can accelerate the process of learning. That's very exciting, because something that could take you 6 months, a year, or 10 years even to learn, now you can learn it in a very small window of time, which is very exciting, because that allows you to train faster, train more people, and get there sooner, right? So it's accelerating the pace of technology advancement. So we're using technology to advance technology, right? I think it's gonna break barriers, right? Because right now, the way we teach, the way we learn, right? Training is doing, right? You have to do something in order to understand it, to become better at it. So virtual reality, what it's giving us is the opportunity to train in any environment, in any geographical location. So there's no more geographical barriers. You don't have to go to a certain place to learn that skill. you can do it from the comfort of your living room, which is amazing, right? It doesn't cost you a lot of money either, right? A virtual reality headset is going to cost you $200-300, which is ridiculous. It's cheaper than a phone. So now a lot of people have access to this technology, and a lot of people have access to learn faster whatever they need to learn. There is a barrier, right? Like Dr. Victor was saying, the rate at which we use technology. There's some people that are adverse to technology. They don't want to see it. They don't want to use it. They're like, people say this is the devil, right? Some people use a virtual reality headset and they say, whoa, 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 whoa. This is the devil, right? What are you doing to me? Some people are going to reject technology, and they're not gonna be the ones to advance like everybody else. So we have to embrace it. We have to understand it. So it's the ones that are working with this technology, it's our responsibility to understand the impact these technologies are going to have in the society, right? What's it going to do? Well, if I train somebody with this tool, is it going to be a better person? Is it going to help them achieve what they want? Is it going to deviate and do something different and then make a negative impact and then, bring down society because of that? These are things that we have to ask ourselves when we're developing and we're creating these new technologies, when we're working with AI. We need to think about the implications of what's going to happen. But I think the promise of what technology today can do for us in terms of training and educating and learning, I think is huge. And it's not something that is going to happen in a few years. It's already happening right now. There's companies already embracing virtual reality technology to onboard employees, to train them on very specific tasks or machines. Oil platforms, you don't have to go to the old platforms anymore to train for that. You can do it from anywhere very cheaply. And so it's happening right now, and I think it's very exciting. It's just, we have to be very careful on how we're going to use it and where it's going to go from here.
Thank you, Marco. Francesca, can you continue, please?
Absolutely. Yeah, I enjoyed hearing everybody's answers, and I enjoy that I get to answer last because I get to see patterns in what everybody's answers say. I think one of the things that I jotted down on my notebook here is that technology moves really quickly and develops really quickly, but it's very slow to translate out of that lab, that theoretical space, that university, the R&D, space, and into society and to become adopted. And there's a lot of challenges legally, politically, financially, economically, socially that keep technology from translating out at the rate that it develops. And that's for better or for worse, because there are actual consequences and externalities that we have to worry about, of course, with technology, and if it falls in the right hands or is used for nefarious purposes. But then there's also instances where this technology has the potential to benefit more people and is not translating, and by it not translating quickly is causing harm or continued harm that is preventable, and that we can do something about. So I think it's very interesting, and it kind of made me think of the point of students, and if you think of students as these new professionals, because I also work in academia, so I can consider that to be my new professional group. The idea of training students to be well-rounded versus extremely deep in one topic, which is not to say that one is better than the other, but that a well-rounded sort of education and pockets of deep knowledge is really seems to be a good combination in my experience, and with my colleagues and my own students as well, because you can kind of understand why, if you have two different, let's say, medical devices that you were working on, or medical products, why one of them translates out and becomes a very successful tool that is adopted in society, and why the other one fails to leave the lab. And a lot of times what I've noticed working with people who have sort of an engineering mindset or an engineering background and just work in that capacity is that if you don't understand the translation process and all the things that that go into that, then you might have trouble being successful as an entrepreneur or in just supporting that technology to translate. And I think it is important that we have more education in that area of understanding, well, how do I get my medical device covered anyway? And what should I be considering when I am developing my medical device, specifically my biomechatronic device? And one example that I like to use is, so it goes into effect in development and also afterwards when you're trying to graduate out of the lab. But in development, there was an example of it was a AI sort of product that was designed to detect skin cancer by looking at a bunch of different freckles and moles. And they did it, and I don't know how far along this got, but I just remember kind of briefly reading about it. And it was pretty accurate at identifying, differentiating between which were benign freckles and moles and which ones were cancerous or potentially cancerous. But they got to a certain point in development and came to realize that it only worked on very light shade skin. They had not used diverse skin color in training their model. So it was something that they couldn't continue and push further along. And this is something that if in the very beginning we had sat down with people that perhaps had a little bit of a different background in understanding the epidemiology of who's affected by this and who do we need to consider in our patient group and who is this technology going to affect, then that might have been something that was avoidable. It's sort of a silly example, but that is one that sort of comes to mind. And the other one that's sort of interesting is that there was a time when I worked on a project for a lab that was that needed new technology, but they didn't need sort of cutting edge technology. Their issue was that they needed a device to interface with their extremely old computers and devices that they were using in a biomechatronics lab somewhere else. And it was kind of interesting because there's this idea of appropriate technology and not just developing technology at the highest, most cutting edge, competitive, expensive level, but also developing technology that can interface and be used in low resource settings and doesn't require a huge financial burden for the potential users. So I think that that's another unexplored or underexplored area in training new professionals is the appropriate technology field, which is sort of an interesting thing that we come across in global health when we talk about developing healthcare systems in different countries and how we can actually come in and make an impact in a way that is sustainable for that technology to continue functioning after the global health entity leaves and goes back. So those were my ideas on that.
Thank you, Francesca, and thank you all for your valuable answers. We continue with our next question. And the next question is, how do the implementation of emerging technologies in healthcare and biomechatronics benefit developing countries? Francesca, can you start this brainstorming, please?
Absolutely. I think I was kind of getting into that anyway, naturally. So I will continue to talk about that a little bit. Yeah, I think when it comes to countries that are developing their healthcare system, there's so much potential, and there's also an understanding that countries are not like starting from scratch. There's not any country that's like, hey, it's a blank slate, let's go over and start completely anew. But an understanding that there is a way to improve healthcare systems, keeping in place some of the existing technology and the professionals. And when you do want to introduce a new improvement to a healthcare system or a new technology, thinking about how can we train new professionals to keep their jobs. So let's say, for example, I had a technology that theoretically could do the entire job of a prosthetist, but that means that I'm going to leave a bunch of prosthetists unemployed. Is there a way that I can imagine instead repurposing these professionals to work with this technology or find another role in this healthcare system? Or else I'm going to take a wild guess and say that it wouldn't be a technology that's very supported in that environment. So I think sort of my summary on that is that there's a lot of potential to influence developing nations with healthcare technology. And also to understand, one more thing that I do want to point out really quickly is that there's an epidemiological shift that I think is very important for folks to understand in the healthcare industry of us moving. And it doesn't seem like this because we're in the middle of COVID, but I will still say this in general, that we are overall moving from having infectious diseases be the biggest burden at the beginning of the 1900s. And that was our biggest, hospital issue. That was what most people were getting admitted for. They were also living shorter but healthier lives, but dying younger, to now the main issue being chronic illnesses and people having multiple chronic illnesses, living longer but more unhealthy lives. And I think that there's a lot of potential for us to develop technologies that care for that population, which is growing and becoming more and more of a shift. And when it comes to countries that are more developed, they have already pretty much completely undergone that shift. But in developing nations, they are currently undergoing it. So I would urge, people who are looking at improving developing nations to see where those more advanced or more developed or more higher income countries have done things well and where they have done things badly, and learn from that, because there's an opportunity. You can see the future by looking at them and figure out what have they done well, what have they done wrong, and how can I go back in time and see if I can take care of a lot of preventable issues in developing nations.
Thank you, Francesca. Marco Wansu, can you continue with this brainstorming, please?
Yes, sure. Well, I see in developing countries, there is a lot of opportunity. There is the infrastructure is lacking a lot of things that developing countries have, and that's where the opportunity is. I think if we know how to leverage the new technologies that we have right now that are coming out, and we go to these faraway places where there's no access, where there's no internet, where there's no even electricity, there is new technology that can help us disrupt the way healthcare is done in these locations today. And that's what's very interesting about these new technologies, these emerging technologies, right? Like virtual reality. Now it's crazy to think that now you can take a virtual reality headset, which is, 4 or 5 pounds in weight, that you can put in your carry-on. You can fly over to the Amazon. You can go into the jungle and go to a town where they never seen technology. Now all of a sudden you can give them education, you could give them information, you could give them healthcare that otherwise was impossible to do. So I think it's incredible what we can do now. In Mexico, for example, there is these small towns that have no schools, have no teachers because there is shortage of teachers. There's shortage of infrastructure. Now we can leverage, solar power. We can leverage virtual reality. We can leverage so many new technologies in order to meet the needs of these communities. Also, we also need to know what we are solving, right? Like we were talking previously. What is really what we need to address, right? It's not just the use of technology. It's how we're using technology, or what kind of technologies we need to use in order to solve the problems that the communities have, right? Not because I'm working in AI, not because I'm working in 3D printing, that means that I'm going to solve everybody's problems, because the problem is probably not the one they need, right? The problem is probably water shortage, right? Or hunger, or diseases, right? That you're not going to be able to solve with virtual reality or AI, maybe. But we need to think about, we don't even need to think about emerging technologies. Maybe we can solve the problems with, regular, physical things that we didn't even think about. We need to think in new ways, be innovative, and see how we can solve problems. Like a very clear example that I saw is the problem of fresh water or clean water in Africa, in some countries in Africa. And they solve it by creating a barrel that you can roll and you can push without carrying. and that's it, right? You don't need internet, you don't need a phone, you don't need solar power. You just need a plastic barrel that can carry clean water to your house for kilometers, right? And you just have to push it instead of carry it. So yes, we need to understand how emerging technologies can help us, but what we need to understand first is what kind of problems we're solving and what technologies we're going to use to solve it, if any, right?
Thank you, Marco. Can you continue, Dr. Hegel, please?
Certainly, thank you very much. Two examples I would give of what happens with emerging technologies in developing countries is the times that we can jump ahead in the developing countries. Here's an example. United States invested a lot of money in developing their copper wire communications network throughout the entire country, running copper wires so that they could have their phone system up and running.
Exactly.
When wireless technology began coming on board, like microwave and so on, Chile was years behind the United States in communications. But if you know the geography of Chile, it's 50 kilometers wide to 200 kilometers wide and thousands of miles long. And all they did was set up microwave antennas every so often all the way down their country. One line of microwave antennas to get the country linked. And today, Chile, everybody uses cell phones, and their wireless network for communications is by far much better than the United States and many of the other European countries. Sure, the geography helped them make it easy, but also they entered the technology race at a moment that was convenient for them for whatever reasons and invested in the technology that was current at that time. This is happening over and over again with new technologies where the early adopters end up being a developing country because they have the great need. Wired communications in Chile was tremendously expensive, and so few people had it. When the opportunity comes out for wireless, everybody starts buying phones, and by very short period of time, it's across the country. A very similar example in Africa is the banking, where people are so spread out over Africa, having brick and mortar banks was just not going to be feasible. And other countries had invested so much in banking, a banking system that worked based on that. And in Africa, when you start getting the digital currencies and people are able to start exchanging across countries, across currencies, and being able to move their resources so easily from their phone, it revolutionized banking. And today, banking in Africa, some parts of Africa, is so much electronic banking is so much easier, so much more prevalent. It's legislated much more easily than Europe and the United States, that have to then carve through all these legislations that have been written over years that control the way banking works in a system that's archaic, that's old. And so really the future of all emerging technologies is to be watching for those opportunities, those places where the technology can do these paradigm shifts or these jumps and jump ahead or over things that are bogging down the implementation and the adopting of technologies in that country. So that would be my look at this issue.
Thank you, Dr. Hegel. Dr. Victor, can you continue, please?
Yes, thank you. One of the main things that the technology will bring is opportunities. So before, it was very separate. If you want to have a very good education, you have to go to the best of the universities and then try to go from there to your best of your education. Now, with the technologies that has been spread, if you can take a class on the MIT online, and you only have to have internet, right? Now, if we can imagine what can happen in the future, imagine that if a professor can put some of the knowledge on a virtual class, and everybody will be able to take it. And it doesn't matter if your perception is auditory or sensitive or visual, because it will be a complete immersion on these new technologies. The technology, specifically on virtual reality, it has advanced dramatically in the last 3 years. Like, we passed from having to have a complete room set up to be able to even experience, not even to play, but experience something in virtual reality. You have to set up a whole room, and then you have to calibrate the cameras and make sure that everything is working, and then you start working. Now, you can just take the Oculus, put it on your face, and mark the space, and start doing whatever application you have in your Oculus. And that's amazing because it's portable. You can go any place in the world, like they were commented that before, and this bring more opportunities to everybody. And all these emerging technologies will, by bringing more opportunities, will bring more quality of life for everybody. So if we can imagine that today, what we do today, tomorrow will be affect the whole world, not only one single country. If we pursue the quality of life for everybody, we just have to be careful about not to leave anybody behind. Like, some of the technologies that we create, like, I work with older adults, and some of them reject to have a cell phone, for example. And it's because the technology, it changed and it's too advanced to create these keyboards that has so many icons, and you have to press this one, and you have this application, and suddenly they want to know everything about it, and they read books about it. And they used to have a phone when you dial the numbers, running the round
The dial,
mechanism,
the disc.
and yeah, and they go for that to a keyboard, right, in the phone. But when something came with the screen, and the screen changed, and if you touch it and if you don't know it, something changed dramatically, they start hating that technology. And it's because it's not, the technology is there and it can be adapted to this particular sector of the population, but for some reason is not addressed yet. And that's something the technologies can come not only on the developing countries, but all around the world. Is some sector of the population that has been left behind with this new technology, and it's up to the new developers to address all these issues, to bring everybody. And if a new technology is not working transparent for the user, something is not doing correctly. But that being said, the virtual reality has been jumping from you have to have installed the whole room, have a big computer. At one point we estimate the cost of having a whole set of virtual reality in $5,000, right? But right now you just go $300 and you just have a device that can work anywhere. So that's a big advance in these new technologies. And one of the dreams that we have, and several of my partners at the PhD when we were doing that stuff, was that we hope that one day we don't think about aging as we are losing things, but that we can upgrade things. So by using technology, I might be able to get stronger. I might be able to get some devices that help me to monitor my body. I might be able to see better, to hear better. That's something that is a need right now, and technology can be used for that. And is related to the whole world, not only a particular sector. So that's my participation.
Do we have time for rebuttal comments back, Fermin, or are we?
Yeah, we still have 7-8 minutes more. Can you continue with this arguing this question? This is very interesting.
I would love to give a little testimony of something that we did that I think is very relevant to what we're talking about right now.
Go ahead.
Walter Greenleaf is one of the pioneers in virtual reality medical applications from the Virtual Interaction Lab at Stanford University. He's one of our advisors. For the longest time, he's been using virtual reality, and he wanted to use it to assist in the earthquakes and disasters, natural disasters around the world. But for the longest time, it was the hardest thing to do because there was not a way to bring virtual reality to these places because it was bulky, it was expensive, it was big. And in 2017, while the Mexico earthquake was happening, we got together with a group of companies in Mexico that worked with virtual reality. And we donated about 3,200 Google Cardboards. If you know what Google Cardboard is, basically this, right? So a little virtual reality set that you put your phone in there, and then you can experience virtual reality in a very casual way. So we deployed an app that we developed in order to help people through nature environments and music therapy and mindfulness guided meditations, help them bring their stress and anxiety down. So we deploy these cardboards in all the shelters, in 200 shelters around Mexico City. And then we had people, volunteers, downloading the app and helping people that were staying at these shelters have a little moment of peace and quiet. And it was an amazing experience that we did with a lot of people in Mexico City while this tragedy was happening. So that's a very concrete example of what technology can do to help mitigate and to help alleviate tragedies that happened around the world.
Great, thank you.
I would like to ask a question both to Victor and Chino. When I was doing my PhD, I was doing it in haptic interfaces, and oftentimes I was crossing into the whole topic of virtual reality, but it was still a little bit in its infancy. I would like to ask if you could talk a little bit about haptics-enabled virtual reality versus straight virtual reality. Because when we talk about virtual reality, we can imagine the goggles, maybe a pair of headphones, and so I'm feeding both the auditory and the visual sensory system, but I'm not doing a whole lot with the proprioceptive or the physical contact. And when you talk about training, and if you're going to talk about training in anything, sports or profession that has any motor task to it, you would have to have also something interacting with the physical proprioceptive system. So what's the latest? How do you guys see that? Do you feel that it's not needed, or that it's still a long ways out, or there's some examples? Where are we with that right now?
Victor, if you want to start, please.
Yeah, so right now is a little bit still expensive. It has been cheaper. Like we have the big haptics and the Tesla suit. That the Tesla suit also has tracking devices, so you can move and you will move in virtual reality. But it's more for the like the company sector, not really for the user. But that technology being developed is good, because that means that maybe in 1 or 2 years we will have something that is available for the normal user, and it's cheap enough that you can experience virtual reality or the environment as the whole learning environment, not only the visual and the auditory, but also the haptics on the feeling what's going on. And they have very good results. Like I'm exploring this sector because many of the users that we have on the virtual gym, they might have some auditory problems. They don't hear well anymore, and they complain about, like, well, maybe the sound is not really important to me, but it's because maybe they don't really hear the sound. So we have to explore ways to go around that and allow them to renew that part of feeling by using other haptics. So that's one of the. I think, like, if we also Ready Player One, that's like a dream stuff, right? Like someone that you can just put in and you can immerse yourself in that and have the experience. I was thinking, like, this will change completely everything, like the way that we watch movies, the way we play games, the way we do everything. Like in the future, everything will be personalized. You will have your own headset. If you want to play a terror game at home, immediately something will appear in your room, and you start relating all this stuff, right? So it's more immersive. The only danger that I see in here is that we shouldn't stop being in contact with the real world instead of just became virtual in everything, because virtual everything will be very nice, right? We can have mountains and waterfalls, but we also have to experience that in real life. So imagine these kind of perspectives. Then we go to Disneyland and we spend 2 hours making a line to have 5 minutes of the experience in the ride, right? And then we are happy about that. But if we can do that without having the line, and there are many seniors, for example, this is a very successful testing, that like to travel on virtual reality. They don't want to go and do the things over there, but when I'm with them and I start talking, like, okay, I'm going to explain to you, I don't know, Tulum and the pyramids in Tulum and the coast and how the water is like, and you show pictures in virtual reality, that's the whole experience that they are very happy to have. Like that's something that they really enjoy it, because they like to travel, but they don't like the hassle to go in the bus. And then we have several cases of when they are around the world, they don't really understand the rules in other parts of the world, right? So sometimes that causes some accidents or misunderstandings, and they want to avoid all that, but they still want to go and experience the complete environment.
Oh. Yeah.
Well,
Yep.
I'll just add up some comments to that. First, I think we have to start by defining virtual reality, right? Because not everybody thinks the same about virtual reality, and virtual reality becomes virtual reality when it involves all of the senses, right? So we have to involve the smell, taste, our touch, our eyes, and our hearing, right? So the more involved our senses are, the more real the experience is going to be, because that's the way we experience the world, with all of our senses, right? So virtual reality started with a cardboard, with a visual, then with sound. Now we have haptics, we have haptic suits, we have gloves, we can touch things, we can feel things. And we already have masks that can give you the smells that you want, depending on what environment you're in. And soon enough, you'll be able to taste things as well. So virtual reality, I think, is evolving. I think still in its infancy, right? We still don't understand the power of it. We still don't understand what we can do with it. And we still don't feel comfortable enough in virtual environments yet, right? It's still, a lot of people still get dizzy. A lot of people still don't. We don't have a body in virtual reality, so it looks weird. You look down, there is nothing there. Your avatars have just hands and your face, which you don't see. And so we still have a long way to go. But the reality is that the technology that we have right now, where virtual reality is right now, it's already very useful, and it's already been proven that the impact of the technology has right now can change industries. So yes, we're not there yet, but I think it's exciting to see where we're taking the technology and how we're using the technology in order to solve the problems that the world has, right? And how we embrace it too, because I think most of it is going to be that. It's going to be how we embrace it, how we actually take the technology and use it to our advantage. So some people are doing it. Some people say, no, virtual reality doesn't work, right? It was a fad. This is BS, and let's move to something else. The reality is that the virtual reality is very powerful. It's a very powerful tool. It's going to change the way we think. It's going to change the way we behave, and we need to learn and we need to understand it before it hits us in the face.
Well, thank you so much for this brainstorming. We have to continue with our next question, and the next question is, what impact will the implementation of biomechatronics and technologies and that healthcare have on society? So we will start with Dr. Victor.
Thank you. that's I think that became a transition from the last part that we were talking about. Something that I would like to see is that, like, if we can see the technology as an improvement of our abilities, right? Like, one of the ways to specify this, I don't know, I don't remember right now the name, but it was a competitor that lose, I think, both of his legs. It was a runner, and they create these new legs. There was a mechanic stuff, and then the competitors that has completely healthy were complaining that he was advancing, that he was more advanced than other edition, more technology. Like, he's using more technology. That's why he is winning. And I would like to hear that more. Like, now I'm losing my sense of auditory senses, right? And I start thinking about an upgrade more than losing my senses. And I think that's when it becomes very important in the society, because everything we're doing right now, like they were telling that before, it was we're experiencing, and this is a baby growing. This is something that is just starting to grow, and many people don't understand. Many people doesn't like it, but for sure it will continue evolving, and it became more affordable, and it's going to be uh, everywhere. Like, if we remember how we watch the TV movies and all this back in the 90s, it was completely different. If you see your kids, your nephews, they don't see the TV anymore. They watch everything on the phone now, and everything they see is nothing about channels in the TV. They see YouTube, and they have these follows on their own preferences. And we reach the point when they say, okay, I don't know what I want to see, but I want you to tell me what I want to see. And they just start their own user, and the artificial intelligence tell them what is the kind of content that they might like. And that's why it became a little bit tricky, because we have to make that balance, like how much decision and how much effort we put on things, and how much we let algorithms decide what to do, right? So, as you see, when technologies like this appear, it changed the complete spectrum in the perspective of how we do things, and it's affecting everything. Like, this was a coincidence that was between the new technologies together with COVID, right? COVID changed everything, how we interact in the world, and virtual reality can present a solution to that, how we interact. Um, we have some exercise groups that we attend twice a week, and the 5 minutes before and 5 minutes later the exercise became more important than the exercise by itself, because people still want to hang out and talk and know how they are doing in the real world, right? And I think that's a very, very powerful impact that is going to make in the society. Like, if these kind of things continue, we're going to start moving into the virtual environment to interact with each other. But we still have not to forget that this is only a representation, and it's a tool that we have to use. It's not the goal, but it's only the tool that we use to reach something.
Thank you, Dr. Victor. Dr. Hegel, can you continue, please?
Sure. I'm thinking about what Victor's saying. I think of a group of teenagers sitting around in a circle, and they're all looking at their phone. Nobody's looking at each other, but they're interacting. Some of us older people will look at it and say they're not even talking to each other, but they're actually interacting online. Some of them, and sometimes they're not. But for example, they could be playing Among Us, one of the new games online where they're interacting right there, playing, participating, and it's fused into that virtual reality what is actually valuable to those kids, and to the point that they don't even converse in the real world, or they're not even friends in the real world. I don't know, Victor, if maybe we must say that some parts of our reality are going to be carried out in the virtual world. That's the reality for this next generation, and not in everything. But some segment of their brain is invested in their relationships, their online relationships. My daughter was saying, I can't understand this couple, this boy and a girl. They're a couple. They are, sending plenty of messages back and forth, but when they see each other, they say nothing to each other. They're talking to other people, and there's no relationship, real relationship, what we would call real, between that couple. But online, they are very much involved and engaged. So I don't know what that's going to look like. Seems like we've deviated somewhat from healthcare when we're talking about this. I wanted to come back to the implementation of these technologies in third world healthcare, and how many technologies have been able to be mounted right onto the cell phone. And so the ubiquitous cell phone that has allowed us to have, a light, a camera, and a phone, a microphone, and some of those technologies that have been able to go out into the third world and do diagnostics have revolutionized the being able to do an eye exam. Many countries in Africa now, and even here in Mexico, the teacher is trained to do an eye exam, and he or she can do an eye exam on the entire classroom at the beginning of the year and filter out those kids that do need attention with regard to their eyesight. Huge opportunities, huge advances that, because it's mounted on this ubiquitous cell phone, has given us a great opportunity to really help lots and lots of people. So I don't know, Francesca, if you could talk into that, but I don't know if it's not Francesca's turn. Yeah, it is. So
yeah, I guess it's Francesca's turn.
Thank you. Yeah, I really like the what you left me on, the cell phone, and those tools, and kind of bringing up that third world thing again, the developing nations thing, which are, I think we just usually call them by like their income bracket now, usually, but that's okay. We'll go with developing nations, and I think it's really interesting because I remember speaking to one of my professors in grad school was on the patent for a microscope that could attach, one of the first microscopes that could attach to the iPhone camera, so that they could, in really remote locations, like send, when they were doing labs and someone had suspected smallpox or something like this, and they were able to take a picture, looking through the microscope lens, take a picture of what they were seeing and text it immediately to the lab, in the capital city, and get an answer right away. And this is something that seems kind of simple because when I was in biology class, I just kind of stuck my camera in the microscope. I didn't think of this, but this was before then, and it was one of the first times that they were thinking of doing this, which is great, and it definitely helps share this technology a little bit more equally throughout society and share those centralized resources that when we were developing healthcare systems, we went from doctors doing home visits to them saying, hey, we should centralize and put all of our resources in big hospitals in the biggest cities, which is great, and it had a purpose back then. And then patients will come to us. But now that we have a different population set where people have chronic long-term conditions and they live everywhere, they live all over, because we're able to get water and electricity and other things that live out in more rural areas. People are spread out all over, and they're also sick and they need to get care pretty often. So it's interesting because we are now working on designing new health systems, slowly, incrementally, coming up with technologies that can bring these services to people or allow them to access it remotely, without having to travel, without having that burden of having to travel to the doctor or take, especially if it's a condition where you need frequent care and you need frequent updates. So that obviously taking a picture with your phone and texting it to the doctor is one way of doing that. Another way of doing that is, something that we're currently working on, which is bringing mobile clinics out to visit patients who live really far away. And one thing that we do is we use epidemiological mapping to basically say, when it comes to these chronic conditions, we have data that these governments collect, and we know where people are living who are, for example, they're diabetic, but they live really far away from the nearest doctor or hospital or area where they can get care. So based on our calculations, we're assuming that they're having trouble taking care of their diabetes and staying under metabolic control. So what we're going to do is we're going to reroute our resources to those areas to deliver them the care in their area that's in their town. So instead of having to drive 3 hours, they maybe just have to drive 15 minutes to like the nearest grocery store or something like this, which is an interesting way. And when I get a lot of students who come to me or want to say, like, I made this thing and I made it for developing countries, and I'm like, that's great, but you know that we could also use this in Alabama. We could also use this in parts of other countries, of really high income countries. That high income, middle income, low income status is just based on average GDP, but not a descriptor of how equitable that society is. And there was a special UN representative who came to Alabama. Alabama's in the US. It is in the highest, income country, one of, these amazing top countries, so technologically advanced. But this UN reporter came to a community in Alabama and found outbreaks of hookworm disease and waterborne infections and just really horrible, like, archaic things going on, and lack of water and infrastructure and basic human needs. So he submitted a report saying this is worse than a lot of the really lowest income countries, this particular area. So we always have to remember that countries are not homogenous. There's a lot of, especially, we can look at highly inequitable societies and think of applications for these technologies. And one of my favorites, which is very like in fashion right now, is the use of telehealth, which I think Marco brought up, or like hinted at bringing up earlier, where telehealth and being able to FaceTime or call with your doctor or Zoom with your doctor online was a thing before the pandemic. It really was. It was not, but it was not adopted because a lot of doctors, particularly, I can speak about the US in particular, but other countries handled it a little differently, were afraid of the legal implications and the risk of FaceTiming with a patient and not being able to fully see for themselves everything that was going on. And it's interesting because it wasn't until this huge, dangerous external factor of a pandemic that they said, you know what, never mind, I think it's worth it. Let's adopt telehealth. Let's have FaceTime. Let's have Zoom with our patients. And I think I'm happy with the adoption of it because we have older patient demographics. We have people that are disabled. We have people that work multiple jobs. We have people that live in rural areas. There's all sorts of levels and identities of marginalization that this technology is helping. And so that's why I'm very excited about the translation and the adoption of these technologies, because they have really, really far-reaching implications.
I'm curious on the monetization of this now, because for doctors, the only way you charged was your prescription. It's a prescription and the consulta,
Right.
the fee for the visit, the doctor's visit fee. So how are we going to start monetizing this where a 3-minute message back and forth in WhatsApp?
Right.
It'd be great if that was easily monetized in pesos, in a few cents, and whatever it is, and that the doctor would really see a benefit to having these rapid fire appointments.
Mm-hmm.
So yeah, and then I'm thinking back to virtual reality, of course, that the doctor could have his headset on, and what could he be being fed through a headset? And I don't know if you guys, if Marco, you could talk into that. What could he already be being fed in that interview? we talked a long time ago about the telesurgery, and that we would be doing the surgery long distance, where you'd have the expert online with a robot guiding the surgery with a remote robot doing the task. But that model, I still don't think is functional. And then we actually had a case in Mexico where that went into litigation because, and so who was to blame for what happened? The local surgeon or the remote surgeon? And it all came tumbling down. But anyway, Marco, maybe you talk into.
Sure. Well, the first image that pops into my mind when I see this question, how the implementation of these new technologies is going to affect society in healthcare. The first thing that I see is a kid with an Iron Man prosthetic going, "I'm super powerful," right? And I think that's very powerful to see that with a prosthetic that makes you look like a superhero, you become invincible. Then you're changing the narrative, right? You're changing the way people perceive you. If you're a kid, before you were seen as a disabled kid that you couldn't do anything, right? And then you grow up with a lot of barriers, right? Mental barriers. But when you have a prosthetic that makes you look like you're Iron Man, then you're invincible. Then everybody wants to be your friend, right? Then you're changing the way people are perceiving these kids, these disabled kids, and now they become the center of attention, right? So you're changing society. You're changing how kids develop their self-esteem, how they become better people, and you did it with a prosthetic plastic arm, right? Which I think it's incredible, the impact that you can have with this. And one of the things I see when I talk about new technologies in healthcare is accessibility, right? Now a kid can have a prosthetic arm built to its size, and then when they grow up, they can just print another one bigger, right? And they keep doing that until they reach an adult stage where you don't grow anymore, and then you have the same size of. And it doesn't cost you a lot. Now you can print them. You can make them from any 3D printer that you want if you have the design, right? The blueprint. So I think accessibility and convenience are the words that I'm looking for when it comes to healthcare technology in how they impact society. And the result is quality of life. So we're raising the quality of life with the technology because we're making it more accessible and more convenient for people to have, and it's cheaper also, right? And going back to what you were saying, Dr. Hugo, about the virtual reality and what you can do with it is the same thing, right? So you put a headset on, you have a headset in a remote location, so you can talk to your patients on a more, let's say, private setting, right? So when you're immersed in this virtual reality setting, the patient thinks they're in the private setting, they can talk to their physician, they can talk more freely. You feel that you're there with the person, so you can express yourself better, right? Because when you're on a screen, right, people that live in remote locations, they're not used to screens. They're not going to feel comfortable talking to a computer. But if you put a headset on and you put a person in front of them and you say, "Hey, I'm right here. Tell me what's wrong with you," they'll be more open to talk to you. They'll be more empathetic. They'll be more willing to tell you what's going on with them, and then they can show you what's happening with them, right? They can point you. Maybe you won't be able to see them, the real body and the real problem that they have if it's physical, right? But at least they can talk to you about it, and then they can send you a video or pictures of that, and then you can have a better understanding of what's going on with that person, and you can have access to these people, right? And it's not going to be very expensive at all, right? Having a headset, it's going to cost you $300 plus whatever internet you can get from a phone, and you can do it. So I think using these technologies to advance healthcare is going to help us reach more people, right, in developing countries, and help them to meet their needs, where they are, and not be complicated with we need to transfer these people to a city, right, where there's hospitals with better healthcare. I mean, you can treat most of the stuff there where they are, and then if they really need to move, then you can set up so they can be transferred to a location where they can get the help they need.
And yet, at the same time, we'd have to say, how do we monetize that, right? That it would have to be monetizable too, because
yes,
I mean, sure, you'll have the nonprofits doing some of this work, but if you could monetize it, then where those few cents or a few pesos or a few dollars on the task, where it doesn't cost the patient much, but it is costing him something, and that is quickly, by the amount, by the volume, then we can make it monetizable. It's going to have to be at some
totally
point.
yes. No, yeah, it has to be, because in order that innovation it's pushed by financial interest, right? There is somebody behind it that needs to make a buck in order to make this happen. So it's going to happen. I mean, the opportunity is there. I think in developing countries like Latin America, there is a lot of opportunity, and there is a lot of money to be made with these opportunities. Financial sector, right? There is a lot of underserved population in Mexico and Latin America that don't have access to the banks, right? So fintech is becoming huge in Latin America, because now you're giving them access to credit cards, to debit cards that otherwise they're not able to get. Same thing with healthcare. Right? Healthcare, there is a huge need, right? We don't have hospitals everywhere. They're very expensive. Insurance is very expensive. How do you reach that population? Well, technology. You do it through telehealth, like Francesca was saying, and you charge very small amounts, or you charge a monthly fee that is very, very small, and you can make not a buck, but a lot of money, right? These are models that are based on scalability, right? So you can reach hundreds and millions of people. You can make a lot of money.
Right. I just want to add in really quickly that it's also, what you guys are saying is completely right, and I think the key sort of ingredient in why that has so much potential to have telehealth and to have even virtual reality used and adopted as a tool widely is because of what we were talking about earlier, that most of these people have these chronic conditions where you just need like a regular sort of checkup. We're not suggesting that we use telehealth or virtual reality when there's an emergency, or when someone's in a car accident, or when someone needs surgery or needs to like properly go to the hospital. It's for there's an entire public health system that's dedicated to prevention and to keeping things from getting to that emergent needs surgery immediately level. And a lot of times we miss that opportunity to intervene sooner. And we can use emerging technologies like virtual reality technologies and like telehealth and things like that to regularly extend health access to these people and check on them continuously to keep it at a dull roar. It is possible to be diabetic and to live with diabetes and manage your glucose levels for the rest of your life. Once you're diagnosed with diabetes, there's no more prevention. You're not preventing that person from getting diabetes anymore. We're now switching to this maintenance of, you have it, but there's people that maintain their diabetes and they do a great job, and they can still have very active lives, and they can change their diet, and they can handle it well, and not that many complications happen. And then there's people who never have a chance to go to the doctor. Maybe they're unaware about what behaviors or actions or shifts they should be doing. They experience a lot of complications, these acute complications like amputations arise. And we see this in our line of work a lot, where 85% of amputees in Mexico are from diabetes. And that means 100% of them are preventable. So there is a huge, huge opportunity for us to extend the basic primary health care to people. And this is also has a lot of potential for rehabilitative long-term care settings with older demographics, et cetera, et cetera. So it's definitely a huge and promising land for that technology.
I want to add to what Francesca was saying, because she's touching a very important point in the healthcare industry as a whole, because we're seeing at a global scale the healthcare industry is becoming saturated. There is so many illnesses that we can't treat anymore. It's becoming super expensive. There is not enough infrastructure. So the healthcare industry is moving towards preventive medicine now. This is a trend. This is a huge trend that's happening all across the world. Healthcare is moving to preventive medicine. And what we're trying to do, what they're trying to do, is we're trying to address illnesses before they happen, because it's too costly for everybody and the system is not able to provide for everybody anymore. So now we need to focus on how do we prevent these illnesses? How do we help humanity to become more present and mindful that we need to keep ourselves in check before something happens, right? And that's what these new trends of mindfulness and these new trends of self-awareness and self-care are taking a stronghold, because we are becoming more aware that we need to take care of ourselves before something happens to us.
Right.
Yeah.
Well, thank you for all your values answers. We can conclude in this part of, or this section, that the technology is a tool to help societies to solve these kind of needs. We have a...
But we didn't give Victor a chance to answer this question, did we?
Oh, Victor.
I just want to make a quick comment. Think about this case scenario that I know is real. The only way to pay a doctor is if he receive an appointment. By he being paid like that, he make the patient to drive all the way downtown, park there, stay in the line for 30 minutes, attending, and it's for only 10 minutes, only to give the new prescription, right? The patient says, why he does not give the prescription to me and I go to the pharmacy and take it? And it's because it's a government policy involved in this. And when the whole government policy is forbidden for people to work online with patients, it's very difficult to take that back. So from all the bad things that COVID bring, one of the good things they bring was that the government has to move together with the health system. It has to improve fast, because this cannot be the same situation that it is as it was right now. And when you talk about policies and the politics, and many people, what they like is like, let's, if it's not break it, let's don't fix it. But you can improve this, yeah, but it's not broke, so let's leave it like that. So when it came an emergency, that brings the opportunity to take all these new technologies to the health system. Because before it was a complete system that is very fat and very hard to make it move, only to make these changes, right? So that is something that is happening right now, because it's an emergency situation. And that's something that is, I assume, is good for everybody, because the patient don't want to go and make 1 or 2 hours downtown, find a place to park, and when it's cold, it's even worse, because it might be a -40. He has to get out of the car, go to the appointment with the doctor, and then he has to just receive the prescription. What is something that could be done online?
We have to be
right?
careful not to throw the baby out with the bathwater. The policies have a reason, right? And it was because of malpractice and abuse. And so you have to have these checks and balances, except that we have to change what those checks and balances are, how they work. All of that has to be reevaluated from the get-go. Some systems simply disappear with time and are outdated. Like, I imagine there's all kinds of policies in different countries about telegraph. Well, telegraph, who uses telegraph anymore? I think there's a few banking wire systems that still work on telegraph, but I'm sure those laws are there on the books and nobody's bothered to change them, or maybe some have. So some will just become outdated and not get used, but many we have to go through that whole process of really reevaluating, and there's all kinds of interests involved. But you've hit on it exactly. Is the issue is with the policies.
Yeah, and the reason of the policy, it has to stay there, Like, we cannot go back to the mistakes that were made. We have to improve the system based on
Right.
that. So you're very right about that. I cannot agree more on that.
Yeah.
Right.
Thank you, Dr. Victor. Well, to continue, what legal implications should be considered to implement healthcare technologies and biomechatronic device in society? Marco Wang Su, can you start with this brainstorming of this very interesting question?
How many hours we have left?
We still have time. Don't worry about it.
This is a big question, I think. Especially when you're talking about virtual reality, and we talked about this before we started. Virtual reality is a technology that can get a lot of information from the user, right? Movement, voice, eye tracking, you name it. And the question is who's going to use this information, and how is this information going to be handled, right? The legal implications are huge, and I don't think we're going to be able to tackle them here. But like we already talked about psychological profiles for our clients, right? Because we're doing diagnostics for stress and anxiety in the workplace. So how do you keep that information safe? Who's handling that information? Who has the privilege to see that information, right? Neither the company nor us that are developing the platform are supposed to be able to see that information, right? It has to be encrypted. It has to be only accessible for the user itself, and they have to give permission in order for their company to get a hold of that information, right? And if you're using technologies like virtual reality or AI that can, penetrate all kinds of different levels of data, who's going to control that, right? And how they're going to use that information? Is it going to be to help people to become better persons, or they're going to use it against them in order to fire people, to discriminate people? I mean, there is a lot of implications that we haven't seen, and that we're not going to see until the technology is out there and it's being used and it's been applied in different settings. And that's when we're going to realize, holy crap, right? This is not helping. This is actually it has a negative impact on certain industry or application. So I think the question is, who's going to be owning that data, and who's going to be using that data?
That will be a very important point we have to analyze here. I don't know what you think about it, Dr. Victor.
So that's a very interesting question, Marco. And one of the things is that if you go back, let's say 15 years ago, it was not really difficult to open a Facebook account, right? But now the Facebook profile is more accurate than many other profiles that the government can access. So they actually access your Facebook account to see where you are, who you are, and what you were doing for the last 10, 15 years. That was normalized later. When you open the account, it was kind of a instructions that what data they were collected. Now with these new devices, is completely immersive and is interactive. One of the things that we find is that every person has a signature when they are playing games. Some people just make the movement. Some people seems like they are synchronizing music for some reason. So every person can be identified based on their movements without knowing anything. You can identify and give an ID and profile only by the signature of the movements. They have a rhythm, they have a certain range of motion. And if you imagine there was a little bit tricky to give your name and your email address with your phone, and they can chart some purchase on your credit card. Now imagine what they can do if they have all your biometrics, right? And there is something that is not legislated yet in the virtual reality headsets. That's something that is concerning. One of the movements that we understand why they do it, but many people doesn't agree with that, is that in order to use an Oculus Quest 2, you have to sign in with your Facebook account. You cannot use your Oculus account anymore, right? And that was a huge, how do you say that, like the deal breaking for many people. And the reason is that we don't know exactly how much data is collecting. When you start, let's say that we purchase a game and we make marks on a room, and you play the first time these games, it feels heavy. Everything feels not smooth at all. But when the headset start learning about the room, everything became so smooth. So they must be collecting some data about that. And that's the only way that they can make these devices work so fast and so cheap, because they are learning on real time what they are doing. And it's unclear yet really what kind of data they are collecting and what will be the consequences of that, because as the perception that we have right now is that, well, anybody can see how I move, anybody can recognize me the way I move or the way I walk from, I don't know, 200 meters distance, right? If somebody knows me, they say, oh, that's Victor coming over there because I walk in a certain way. And it seems like it's unimportant until it became important. So all these questions marks that you are putting on the table is really important. And the thing is that we don't know the answer because we don't know when and how will become important to know all these answers for the data they is collecting on these new tracking devices. Because if you combine 2 or 3 tracking devices, you will get a complete different profile from the same person, and it's more accurate every time, right? At the point that the system will know more about the person than the person himself. And that's the tricky part that I see in that part of the balance, because it's like the YouTube example, right? I don't know what to see, so let me open YouTube and tell me what I want to see. They might know more about us than us. And if these things are used for the improve the quality of life of everybody, that will be okay. But we have cases when they use all this data to rely on the elections of the US, right? The I don't remember the name of the Cambridge Analytica. And that's what every data they were collected became important, but not before that. And we'll see in the future if all these data that we are living like that became important sooner or later. So I'm sorry that I don't have answers for all that, but I ask myself those questions again and again all the time, because I have to answer to my users, right? Like, what kind of data that you are collecting, and I can say what data I'm collecting, but I cannot say what other data the device is collecting.
Thank you, Dr. Victor. I have one intervention special here. We have a special question for our audience, and I guess Dr. Hill and Francesca can answer this in the terms of this question about the legal stuff. Imagine a future where we can change any part of the body easily just to upgrade it. Then the technology will begin to be used only for aesthetic and not necessity. Should we put limit on this?
Yeah, now we're getting into the ethical dilemmas that these opportunities that technology brings has, and I wouldn't just say for aesthetics, but as we've been talking, for the little boy with the prosthetic limb is now super instead of having a disability, he's having a super ability, right? We wear glasses. I wear glasses. It takes my disability, my visual disability, and makes it ideally the same as if I attached some sort of a magnifying. Well, then I have that super ability. That we're already doing that with military being able to wear goggles, night vision when they go into places. A lot of it is, what is it going to be used for? The end use of that makes it a challenge. And it's always going to be, you're always going to have these dilemmas of the technology being used for good, and at the same time that same technology being used for bad. Facebook itself being used for the good of being able to interface and interact and find old friends. Who would go against that? Who would say that that's a bad thing, to be able to reconnect with old friends and make new relationships based on old relationships? But then we see that data is nothing's free in life, and that data is being used to sell us, to market products, to make to convert, to monetize those relationships, and we're allowing that. So talking about a future where we can change a part of a body to not just get back up to the level of ability of somebody else, but to go beyond. Not necessarily can we say that that's going to be a bad thing. We need to put limits on it, and it's going to be these challenges of the use. Rapid prototyping or 3D printing. We're all gung-ho about this, and yet we've 3D printed guns and shot and killed people with it. Right. Well, you're going to put a limit on 3D printing? Well, people can build the gun other ways. It is the ease with which this can be done that becomes an issue, and yet technology needs to serve. Technology doesn't need to be the God. And for those of you who are believers, who believe in higher power, supreme being, who believe in God, there are other metrics besides technology, and we will need to apply not just the technology metric when we evaluate the future, when we evaluate these opportunities that technology brings.
Right.
Great challenging question.
Yeah.
Can I jump in on this question? Because I had some light bulbs go off when I was listening to your answer and reading this question.
Sure.
I was thinking about how, this question says, imagine a future where we can change any part of the body and upgrade it. Are we not doing that now? Can we not? Can I not go to a plastic surgeon and get a nicer looking nose, or some other type of purely aesthetic surgery? And I think it would be silly to suggest that enhancing the way that I look with plastic surgery to please more people doesn't have an effect on how I'm perceived and treated in society. I think it's true. It's not a common discussion, but there's a true fact behind people who look a certain way having different experiences in society based on the way that they look and they're perceived by others, even if this is more of a subconscious bias. And I think we can also see examples of this in genetic manipulation of fetuses and embryos to avoid certain genetic conditions. And I think obviously certain genetically inherited conditions, or to preferentially reduce the risk of that baby being born with a certain disease, which is obviously the positive way to think about it. But then there's the ethical question of, is this going towards eugenics? And also, who has access to this technology? Because there are many, many technologies that are very super advanced biomechatronic technologies, for example, that we can look at different prosthetic devices that exist and technically people can buy them. But because they're not covered by insurance and because they're not supported by the government and only special classes of people can access them or afford them or are covered for them, that only a very small population of people can realistically ever access this technology. And ethically, we have to think about what that means for equity and equality throughout society. And I think that kind of brings me back to the legal implications question, that we need technologists to help guide policy. We are the ones who are in development and creating this technology. We are the ones that can foresee the potential good, the maximum potential good, and also expect the potential harm and the maximum potential harm that could be. And sometimes I think we're so good intentioned that maybe we're not as good as seeing the harm as we are at seeing the good. And I think that's okay. It's not our job to do that, but there are ethicists and there are other people and there are ways to foresee all of the different outcomes that could happen if this technology that you're developing falls in the wrong hands. But I think too often people that are technologists that work in research and development don't see themselves affecting legal or political or economic processes that have to do with this technology. And I try to encourage people around me who are technologists to get involved in at least be in a panel, at least be in a conversation, be in a focus group to talk about the potential of what this technology could do and how it could be used in a harmful way. One example is that you can have an AI that looks at a massive amount of healthcare data and looks at the patient records of everyone, let's say in an entire country. And that's great and that's beautiful. And that can allow us to predict and see trends of what's going to happen with these patients and how can we implement preventative medicine to keep them from having this emergency, or to start implementing a program that's going to reduce their risk of heart disease, for example, or having a heart attack. But you can take that same AI technology and in the hands of a private health insurance company that could preferentially discriminate against sicker, older, disabled patients by saying, hey, they're a financial risk if we cover them. So we want to figure out who is a more expensive patient and not offer services to them. Or we're only going to offer them a contract that is much more expensive than healthier patients. And this is not actually a theoretical. This is something that we've seen manifested. And there are many other examples of technology being used in that way. In facial recognition to unlock your phone can identify and harm, is currently being used in occupied states and in war zones across the world right now, and in places where we have ongoing genocides in our world, to identify certain ethnic classes, for example, in China. So it is something that we always have to be careful of, and sometimes it's not possible for us to really imagine the worst of the worst of the worst, but there's someone out there that can think of it. But I do think it is important that we have a responsibility to think about, if we are trying to promote the most benefit of that technology and adoption of it that's going to help the most amount of people, we have to think about who has access to it, how it gets covered, how it is priced, and push for more leniency and for more leniency legally and politically when it comes to something that has a super high need or a super high potential to impact people. We said with COVID that sort of opened up the doors for telehealth. And that was a positive impact of COVID, was that now doctors and hospitals have been forced to say, okay, well, fine, I guess we'll adopt this and we'll get a legal team together to sit down and talk about the laws, and we'll just have everyone sign a contract before they start the FaceTime call with the doctor. And that was it. That's all obviously it's a simplification, but they were able to very quickly move because they had that pressure. And I think we're going to have to, as technologists, pressure when everyone here is working on conditions that are for long-term patients, chronic diseases. We're not talking about acute reactions. We're not talking about emergency room visits. So we have to sort of communicate that this is a really important area that deserves momentum, and we shouldn't have to wait for that disaster to happen to adjust the legal and the political framework that's regulating these things. And I think one of my common examples that I like to use is two. One of them is that we've brought up quality of life a few different times and how important that is. And I think a lot of folks that I work with personally in biomech are very surprised because the way that we measure quality of life in most cases is the same across all diseases, which you're like, okay, well, that's fine. We made a standardized version, but I have been working with a few folks in health policy and basically have discovered that the quality of life measurement that we're using is discriminatory against people that are disabled, older, or have a chronic long-term condition. So we can't actually use that measurement to define the impact on quality of life for these technologies, because they end up saying you don't really have a big impact on quality of life, and we shouldn't cover or pay for this technology or support its development. And I think that's one sort of root cause that's holding our area back. And the other one is that in the healthcare sphere, you can kind of separate companies into pharmaceutical companies and biotech or medical device companies. And that if you actually look behind the scenes, you see that pharmaceutical companies often, they are huge moneymakers and they're very successful and they're sort of very dominant, particularly in the US, how much they charge and how much insurance will pay for them, and how much money they have in research and development. And part of this is that they have sort of preferential policies and legal and financial deals that support their development and their adoption into society that biotech companies and medical device companies are not taking advantage of. They are not included in those deals. And there is an ongoing effort in academia to ask, if these are all medical treatments for diseases, why are medical device and biotech technologies not getting preferential research and development funding, financial agreements, policy agreements, expedited reviews, et cetera, et cetera, et cetera. And so I think I'm encouraging every engineer that I come across to expand your horizon and start to look into this, because really we are the experts who can start to garner the support for this movement.
Thank you, Francesca. All these values for us, I guess, is a very complete point of view about all these legal implications. And I really appreciate all these responses we hear today. Leave us much to learn about our panelists do and what still needs to be done. We really greatly appreciate your time, and I invite you to give us your personal conclusion about this panel. So we can start with Dr. Hegel. Are you on mute? Hold on.
Oh, yeah.
That's the buzzword for 2020, right? You're on mute. So I did it on purpose. Thank you so much for having us on the panel, and I hope it's been productive to those who have been listening in. Sorry that we only got one question in from the audience. I don't think it was really planned to have too many questions in from the audience, so but we appreciate that. I've had throughout the whole conversation this underlying issue that I just haven't gotten back to, and I want to make statement and let our audience take it with them. And that is, the first question was about training, and we've been talking about learning throughout, and a key question that we're struggling with even in higher ed, but it goes to all fields. And that is, how do you evaluate that education, training, learning, the whole field of evaluation, and then how do you certify that? Because I'm sure that none of you would want to get on a plane to fly across the ocean with a pilot who is only trained virtually thus far. I mean, unless there's some certification that says that pilot is certified, Who certifies? How is he certified? What do we certify? And that certify is of the evaluating that knowledge base or that competence or that whatever. And this is huge. And the first question was also professionals. How do we evaluate and then certify a professional to do something that is for society? You know, how do we evaluate the doctor? They say among doctors that surgeries, you watch one done, then you are supervised as you do one, and then you teach somebody else to do that procedure. And when you've done those 3 times, you're an expert. What is an expert? How do we certify experts? When do we put our life on the line with someone who is an expert? And of course, with doctors and pilots, it comes straight out. But we've even had the incidents with engineering, right? Where a bridge has failed or a vehicle has failed, and it's been an engineering failure because someone, in amongst many other things, usually it's several different causes, but because someone wasn't certified. And that is why we have policies. That's why we have these the legal framework around the professions, so that those who are working in the professions are contributing to society with their profession in an upstanding, ethical, positive way. So I just want to leave that out as a big challenge in the future. It has been a big challenge throughout the years, is how do we evaluate proficiency, professionals, expert, how do we evaluate and how do we certify it? As we provide education worldwide and we say it's readily available, how do we certify that that person has had that education or that learning? So as you hear about new technologies coming on board, ask yourself that question of how do we evaluate, how do we certify, how should we be evaluating and certifying both the technology and the people using them. Thanks so much.
Thank you, Dr. Hegel. Francesca Riccio.
Okay, I'm back even though I was just here. I will keep it short because I just had a great opportunity to answer that question from the audience, which we appreciate. And I will say thank you again for having me on this panel. It's been a really great and interesting conversation. And I'm happy to have been a part of it. And to see so much thoughtfulness like in these fields. I think that's always encouraging. I will just sort of briefly conclude with that. I think that, you know, these technologies, at the very beginning, I said technology develops really quickly, but translates slowly, for better or for worse. And I think that we are a lot of us are at the forefront of developing technology and having the best intentions and the best idea of how this can be used in a positive way. And I think that that's wonderful and it's beautiful and it's admirable. But we also, I would say, don't forget about the translation piece. Don't forget about the policy, the economics, the legal implications, the ethical implications, the potential uses of that technology. And as a technologist, get involved in being part of both seeing your technology truly go all the way to benefit who you expect it to benefit, but also be the person in the room that can speak about the potential harm of that technology. Because it does require people like us to step in and put safeguards up instead of waiting for someone to someone with nefarious intentions to take advantage and to surprise us with the negative potential use of that technology. We don't want to have to figure out, I didn't know it was possible you could 3D print a gun and use that to kill someone, you know. And there are certain things that we can control and certain things that we cannot. But I think that in order to build that more equitable and fair society that we all strive towards, that takes care of all of its people, even with their own unique challenges and levels of marginalization and levels of inequity and income across ages, etc., we have to be involved in that larger conversation and to really advocate for the fair implementation of our technology. So And there's more to do with a technical, a STEM and engineering knowledge than just purely working on the research and development side. And I say this particularly to a lot of my students because there's always obviously a lot of opportunities to work in research and development or in the industry, particularly as an engineer. But I think as time goes on, our culture really embraces social entrepreneurship and social causes and getting involved in what's going on in society and things that we see that are unfair. And you don't have to only volunteer your time once a month picking up trash at the beach or something like this. There are other ways to get involved where you can actually utilize your skills and your knowledge that you developed in school and worked so hard to do in innovative ways. And I challenge everybody to find a way to apply their knowledge for social causes as well.
Thank you, Francesca. Victor Fernandez.
Thank you. I want to say thank you for the invitation, and I enjoy very much being part of this panel. The main idea that I want to leave here is that when you are doing something, think about how is that going to affect other people and try to improve the quality of life of others. It is true, I agree with Francesca that we cannot really know how far that can reach or how our work can be modified in order to be transferred to something else. But when we develop something, we should do it with the best of the intentions, because at this point we have this opportunity to connect with everybody and bring more fairness to everybody. Like everybody will be able to have better education if we use the technology correctly. Everybody will have the opportunities to train what they want to do. And that being said, what Dr. Marco says is Joel is correct. How after we acquire all these skills, we will get certified that we are doing correctly, right? Because he's right, there is some jobs, not all the jobs are that you can fail once or twice and then you will have another opportunity like a soccer player or something like that. Some of these jobs are so important that if you fail once, that's it. So you don't want a doctor to be certified on virtually certified or pilot. So that's something that is on the table right now because the policies of this has not been developed yet. We are on our way to do that, and we have to pay attention right now how to develop those policies to keep the fairness on everything, but also to make sure that what we are doing is reaching and changing the quality of lives of the persons that we intend to do.
Thank you, Dr. Victor. Marco Guangzhou.
Thank you for leaving me at last. I completely agree with Victor and Francesca and Dr. Hugo. I think when my conclusion with this panel and when talking about technology and how we can impact society is human condition. I always take a step back and say, okay, what we're doing, what we're developing, what we're creating, is it gonna help humanity as a whole? Is it gonna help us be better humans, better society, right? The implications that it has. So I think always question what your actions are gonna take you, and if it's gonna be a good outcome or a bad outcome. Always think the worst. Always think what can go bad. You know, how is this that I'm developing? How is this that I'm creating can harm me? Can harm society as a whole? So I think everybody said it already, and that's what I wanna take out of this conversation is, you know, take a step back and reflect on how everything that we're creating, that you're creating, is gonna impact society, right, in a good or bad way. So, and it's always about the human condition, like Victor just said. How does these translate into quality of life? And well, thank you for inviting me, and thank you for having us here. It was fun.
Thank you. Well, I guess all here we are agree that the technological development does not have colors, race, and the purpose is improving the quality of life of societies. I guess it's imperative to generate technological development in order to advance society, and we will contribute to generate solutions since of our fields, since our laboratories, companies, from our universities. So we really appreciate your time to be here in this is the first panel of experts in IEEE Guadalajara section. So this is very important for us. Luis Luque, are you there?
Yes. Well, yes, thank you, Fermin. So, well, I was really excited about the topics that you talk about, your experience, and actually, something happened that I really want to jump to to exchange also some point of view about what you said. It was really nice, but for example, it was something that I tell to my students. I invited them to see the panel. Is that they have to be an open mind and to start looking the presentation or the complete panel and to hear the panelists and to sense and know what they think, how they think. That is really important because they can gain this perspective that you already have thanks to all your career, all your expertise in your area. So definitely, it was really also a nice thing to see the thoughtfulness, like Francesca said. For example, in IEEE and also in the RUSH chapter, we have in IEEE we have the slogan, which is advancing technology for humanity. So probably after this panel, we need to add something more there. Not only advanced technology, but also to see what else can we do, and you show us a little bit more about what else can we do when we talk about technology and the exponential growth of it. So thank you all thank you all the panelists. Thank you, Dr. Joel. Thank you, Dr. Victor. Thank you, Francesca. Thank you, Marco. It was really nice panel. Thank you, Fermin. Also, it was really great the way you go through the panel. And also, thank you all the RUSH chapter IEEE Guadalajara section. Here, all of this was teamwork. We have Dr. Josh is here. Dr. Luis Enrique Gonzalez also worked to make this panel possible. Fermin and all the team this is possible because of the work we do in the team. So thank you all the people that watching us through YouTube, through Facebook. So thank you the panelists, and really nice panel. Thank you so much, and we hope to see you again soon in other activities.
Congratulations to the whole RAS team and IEEE here in Guadalajara. It's a pleasure to be part of IEEE, and I encourage everyone that's listening in to, if you aren't already, become a student member or a member of IEEE. I've been a member for many years.
That's really good thing. Please, the student or the people that are watching us, they can join IEEE, as Dr. Joel said. We have an IEEE membership and also the chapter. For example, Dr. Josh opened in in his university opens the RAS student branch. So if you are studying right now an engineering career, you can join and to be part of these kind of activities, and you can know really nice people and like our panelists today.
Thank you all.
Well,
See you
thank you
soon.
so much. See you.
Bye.
Thank you. Bye-bye.
Bye bye.
Thank you.